Welcome back to it, guys. This is the Now Morning Show. And as the leading form of cancer-related deaths in Trinidad and Tobago amongst men, it's appropriate that today we put prostate cancer and prostate checkups in our spotlight on Now.
Men over 45, come out this Saturday at the advertised locations for free prostate screening exams. These exams are non-invasive. We use a simple blood sample from your finger, just like a diabetes test. It's a rapid test and you get your results within 10 minutes. So make use of this opportunity this Saturday to know your prostate status. Prostate health is good health.
Prostate health is indeed good health. This morning, I want to welcome the Director of Non-Communicable Diseases at the Ministry of Health, Dr. Maria Clapperton, to join us and chat a little bit about prostate health. Good morning to you, Dr. Clapperton.
Good morning. Thank you for having me.
Of course. How are you doing this morning?
I am good. Thank you.
Now, I understand that prostate cancer is the leading cause of cancer-related death in men over 45 in Trinidad and Tobago. Do you have any idea what the numbers are like in terms of as it relates to men with prostate cancer in Trinidad and Tobago?
Yes, so as you rightfully indicated, prostate cancer is the leading cause of cancer-related deaths in Trinidad and Tobago, accounting for about 18% of cancer-related deaths. And in men specifically, about 34% of the cancer-related deaths, prostate cancer being the leading cause. So it is a very important issue, and we seek to take this opportunity to encourage all men to take charge of their health and come out and get screened.
All right. So, Dr. Clapperton, before we get into the screening, I really want to drive home the importance of it, right? And to do so, I really want to find out some more about what prostate cancer, what a life with prostate cancer looks like for men, so that they understand the symptoms maybe, or what the challenges that they may face maybe if they don't check up on it soon enough.
Yes. So for persons, you may be experiencing difficulty with passing urine. So you may have experienced increased urinary frequency, having to go very often, feeling like when you've gone, you haven't completely emptied your bladder and having to go quickly right after. You may have some pain and discomfort when passing urine. You may even notice some blood in the urine or the semen, and you may also experience unintentional weight loss. So we will advise that you don't wait until you feel or experience symptoms to go and see your doctor. This is why we're looking at identifying to you, from the time if you've reached 50, if you're at average risk, or if you're in the at-risk category from as early as age 40. But please get your checkups regularly, and your doctor will guide you as to when your screening will commence and how frequently that should happen.
Doc, tell me who falls into the at-risk category?
So persons who would be at risk would be, in particular, those with a family history of an immediate relative, a father, brother, so who would have had prostate cancer. And, even if it was at an earlier age, even below the age of 50, we would flag those persons at a higher risk and would want to commence screening from as early as age 40. But generally, persons at average risk, we seek to commence screening at the age of 50.
All right, fantastic. And what does the screening look like? Because I know some men still have the stigma that there will be some sort of penetration somewhere, and I really want us to clear that up. I know the minister did a good job of clearing it up at the beginning, but I really wanted to drive that point home as to what the screening looks like now.
Yes, so it's a blood test known as a PSA test, PSA prostate specific antigen test. And usually a blood sample is taken and sent to the lab to assess your PSA levels. This can be used as a form of screening and to also monitor and treat persons who have been diagnosed. So what we have done is we would have put together and introduced at our most recent Men's Health Initiative on the 20th of July a rapid test kit where instead of waiting for your laboratory results to come back in a few months' time on site at the actual outreach screening event, you can have a result back within 10 minutes. In the same way, when you go to test your blood sugar or test your cholesterol or test your blood pressure, you can have an idea as to what your PSA levels are on site immediately.
And when you
So it's
determine those PSA levels,
sorry.
sorry, go ahead, doc.
So your PSA levels, normal PSA levels, should be within the range of 0 to 4 nanograms per milliliter, right? So anything, the test kits will detect from 4 and above to generate a positive test result. So you can have an idea if your PSA levels are 4 and over or less than 4 when we use these rapid test kits. So for persons who screen positive in particular, we will draw a blood sample and send to the laboratory for confirmatory testing at that time. But it is still good in a way that it reduces the turnaround time for you to have an idea and, would relieve some level of anxiety, as you can imagine, from having to wait on that initial test result to come back from the lab.
All right. So I wanted to find out as well in terms of treatment for prostate cancer. If you are to test positive, is there a lifestyle change that you can do that would adjust the situation, or would you have to go through whatever the cancer treatment is?
Well, lifestyle change is always recommended across the board, making healthy food choices and increasing your levels of physical activity. Persons who have positive test results or are found to have elevated PSA levels, it will trigger more invasive testing. So you are referred to a urologist for follow-up care. The urologist will review your file, your history, and request some additional testing. At that point, you may have further tests such as, a biopsy, an ultrasound, primarily a rectal ultrasound to see the size and the shape of the prostate, a digital rectal examination to feel the size, the shape, the consistency of the prostate gland, and if the test results continue to be positive, it will prompt the request to have a biopsy to take a sample or a piece to see if this is, malignant, cancerous, or non-cancerous, because you can have enlargement of the prostate that is not necessarily cancer. Mm-hmm. So in an event like that, further invasive testing would be required, and you should be mindful that this will be the usual follow-up care.
All right. Thank you very much for clearing that up there, Doc. Now, when it comes to these free prostate screenings happening this Saturday, tell me some of the locations that we can go to get access to those free screenings.
Yes, so we have brought it even closer to you. There are several locations at shopping centers and malls. So we have this Saturday on the 24th of August at Long Circular Mall from 10 a.m. to 3 p.m., Trin City Mall from 10 a.m. to 5 p.m., South Park Mall 10 a.m. to 2 p.m., and the Sangre Grande Enhanced Health Center from 10 a.m. to 2 p.m. So please come out at all of these locations. Come to the location nearest to you and bring a brother, bring a friend, anyone who is of the age and would like to have have a checkup.
Fantastic. Now, Doc, tell me something about these kits, the testing kits. Are they available outside of these testings? Are they available like for sale anywhere? We could go and buy them so we could do the test as well?
So at this point in time, they are only available at the outreach activities, meaning these activities that take place for health fairs or wellness festivals, outreach activities only. They are also not available currently at the health centers. So they are for the outreach activities so that we can reduce the turnaround time for you to have an idea as to what your PSA levels are like. So there is that convenience, similar to having a blood sugar test. To clarify and to, so that you it's not invasive, meaning that it's a finger stick, okay? We are not taking a lot of blood from you. It is not a blood draw. In the same way you would stick your finger to check your blood sugar and to check your cholesterol, we are just sticking your finger and taking 2 drops of blood. And in 10 minutes time, we can read the result just in a similar fashion like a pregnancy test.
Right.
We look for 1 line being negative and 2 lines being a positive test result. So prior to doing the test, a physician on site will provide some pre-test counseling. We obtain your consent, and then we proceed with the test. And after the 10 minutes have elapsed, the physician on site will then provide post-test counseling for you on your test results and advise you on what your follow-up care or referral as required would be like.
Fantastic. Well, I think that's the information there. So I thank you very much for joining us this morning, Dr. Clapperton, and all the best. I know it's going to be a busy day on Saturday at the ministry and at all the various locations. So all the best to you guys. And I really want to encourage Trinidad and Tobago, especially men, 40 years and over, 45 years and over, come on out to these screenings. Check the ones that are closest to you. Long Circular Mall, Trin City Mall, South Park Mall, or the Sangre Grande Enhanced Health Center. Dr. Clapperton, thank you so much. Enjoy the rest of your day.
You're most welcome.
Take care. That's Dr. Maria Clapperton, Director of Non-Communicable Diseases at the Ministry of Health, encouraging us, all men aged 45 and over, 40 and over, if you know you're at risk, to come on down to the screenings. They are absolutely free, very quick, and you get the opportunity to make sure that you're in a good place. Yeah? Let's take a quick break and come back with more in our morning show. Stick around.